Hello, and welcome to Talk About It Tuesday. I'm your host, Keith Taylor. This week, we're going to be talking about the International Overdose Awareness Day, which is August the 31st. Overdose Awareness Day honors the lives lost to overdose and aims to reduce the stigma surrounding substance-related passings. We also use this day to educate our communities and raise awareness about mental health and substance disorder. Today we're going to be talking with a few guests. Our first guest is Pablo Rivera, one of our Oasis caseworkers here at StayWell.
Thank you, Keith. It's a pleasure to be here today.
So let's get right into it. Talk a little bit about what Overdose Awareness Day brings to us.
Well, it's to raise awareness of overdose and reduce the stigma of drug-related death. It's also to acknowledge the grief of people that and families and friends that lose someone due to the overdose. And for others that has a permanent injury to the overdose drugs. And talking about also with the stigma, stigma sometimes can be very, very bad and have a negative side effect on the self-esteem of a person. That sometimes that do not allow them, because of that stigma, to continue or to look for programs where they can get the assistance that they need.
Exactly. So what services are available here at StayWell for those who are struggling?
Here at StayWell, we offer, as well at Oasis program, we offer the IOP program. And basically, IOP program is to address the need of individuals struggling with mental health and also substance abuse, who need more support through groups and sometimes to individual. And basically, our OIP program, they need, it's 9 hours a week, but we divide it into 3 hours per week for around 4 to 6 weeks is the duration of the IOP. And basically, during the IOP program, our clinicians help our patients to establish their mood, to work and to improve their life coping skills, promoting them, solving problems, and so forth. Good thing also is for males and females in both English and Spanish. Along with that, the program has, as you mentioned before, not just only myself as a case manager in the Oasis program. Also, we have a case manager here that we help our patients, our clients, in the social, in different areas, in the community.
Okay. So I'm glad you mentioned that. Does StayWell provide any kind of medication treatment?
Yes, we do. We have, as I mentioned before, the MAP program, and also we have what is called the medications that we offer to our patients in Oasis program, and it's called the Sebastian medication. And basically, with people who are patients that are taking these medications, they reduce the stress and the anxiety that they feel during this process. Also, they help them to improve the changes of success. Through this treatment, our patients and our populations, they help them with their pain, with the struggling, the anxiety, to the point that they can eventually have the trust and gain the trust and then be successful with the program. Also, I just wanted to mention then during the process of the IOP, besides the clinician working with the moods of the patients and help them to be self-sufficient. Trying to communicate and to relate to, their frustrations, when they have it. That way our clinicians can help them to manage that. Good thing is that we also have, as you mentioned before, not just only myself in Oasis, also here in StayWell 1309, we have a case manager also. And part of our job is exactly to help our clients, our patients, on a social, emotional, and social problems that they can have. Even looking for another programs, go inpatients, go outpatients. That's what we're here to help them.
Is there anything else our viewers should know about services here at StayWell Health Center?
Yeah, Kit. Besides the IOP program here at StayWell and Oasis program, we have individual group therapy. We have also medication evaluation, and also we have smoke cessation, the MAP program, for people who wanted to quit smoking.
Now that we've learned about some of the services that StayWell has, I have Kasima here to tell you about one more. Kasima?
Thank you, Keith. The program that we have available is SSP, which is a syringe services program. It's a harm reduction program. And what it is that we have clients that come and they bring us their used needles and we provide them with clean needles. And what this does is help prevent the spread of HIV and also Hep C. We also will get them connected with services when they're willing and ready to go. We're actually located at 770 East Main Street, Greater Waterbury Interfaith Ministries, on Mondays between the hours of 11 a.m. to 1 p.m. and Tuesdays from 8 a.m. to 12 p.m. We look forward to seeing you. Stop by and see us.
Thank you, Kasima. You did a lot better than I could. But now I'm going to introduce Jennifer DeWitt. She's from the City of Waterbury Health Department. She's going to be explaining to us about the International Opioid Overdose Awareness Day, which is going to be on Tuesday, August the 31st.
Thank you, Keith. So on August 31st, which is internationally recognized as Overdose Awareness Day, the City of Waterbury Department of Public Health and the membership of the Greater Waterbury Opioid Abuse Prevention Work Group will be co-hosting a panel discussion on the film Uprooting Addiction. We've purchased the licensing agreement, and for folks who register, they will be able to, on their own or in congregate settings or in their living room with friends or family, be able to view the film Uprooting Addiction anywhere between August 26th and August 31st. It is an intimate look at the link between trauma, addiction, and recovery, and in particular ACEs, adverse childhood experiences, and how they impact the development of substance use disorders and other conditions. And that watch party will then turn into part 2, which is a Zoom panel discussion at 6 p.m. on the 31st with the producer and some of the participants in the film. That panel is going to be an open dialogue between folks who registered for the event and folks who were part of the film to more closely examine those topics. International Overdose Awareness Day is meant to remember individuals who we've lost as a result of overdose, to highlight the importance of awareness about and education to resources, harm reduction, and other strategies that can prevent overdose, and to also help folks connect to care with the message of hope for recovery interwoven throughout all of those topics. So when folks register by emailing me at jdewitt@waterburyct.org, they will receive a password-protected video link to watch the film anytime between August 26th and the 31st. They will receive a link for a Google form where they can provide the name, age, and date of passing of a loved one that they would like to remember on International Overdose Awareness Day. And we're also going to ask participants to define for us what recovery means to them. What does it look like? What does it feel like? We want to hear from people in recovery what recovery means, because oftentimes when people are in the throes of addiction, it can feel helpless and hopeless and like there's no way out. And we know that everyone that survives an overdose, everyone that still draws breath, they have an opportunity and a chance at recovery, and we want to make sure that that message is heard loud and clear by people who are in recovery today. So we hope to celebrate the possibility of recovery, to remember and acknowledge people who've been lost, to take a moment to place some positive energy and thought on folks who may be struggling or hurting or who are out there and haven't yet found the treatment and resources that they need. And again, to welcome that ongoing dialogue and discussion regarding this topic. So we hope you'll join us. We look forward to getting your registration, again, at jdewitt@waterburyct.org.
Thank you. Tell us one more time how to register for the event.
Okay, so step one, you are going to send me an email letting me know that you as an individual or your group would like to register. Step two, I'm going to send you a link and password for the video. I'm going to send you a link for a Google form where you can share your loved one's name and some information about what recovery means to you. And if you are hosting a watch party with a group in a congregate setting, or a family group, whatever kind of group, your meeting group, your home group, your IOP, your counseling program that you attend, if you're one of the first 20 groups to register, we will put together a swag bag for you, which is going to be some goodies that you can bring back to your group. We will have International Overdose Awareness Day t-shirts with the #EndOverdose logo. They will be in a variety of sizes. There will be resources from State Department of Public Health and State Department of Mental Health and Addiction Services, as well as many of the providers that serve on the opioid work group. So you'll have information about treatment resources, harm reduction resources, recovery resources. The whole continuum of care will be provided in that bag, as well as some really cool giveaways. There might be squeezy stress balls, there might be notepads, there might be personal hygiene items, there might be gift cards for coffee, you never know. So those swag bags are going to have a variety of items, and they're going to have a really cool discussion guide, a spiral bound discussion guide from the film that we were able to produce with a generous donation from Connecticut Community Foundation. So that will be in a swag bag. They'll be available at Waterbury Health Department to pick up between August 26th and August 31st for groups who are hosting a watch party. And the last step, what we want back from people who host a watch party, is a photo from you. What does recovery look like to you? So if that's everyone in their purple End Overdose t-shirts, or for privacy protection, if it's a group photo of folks from behind watching the film, however you want to depict that, we want to highlight it on our social media so that, again, people can be reminded that recovery does happen, and that not everyone is lost to overdose. Many people survive an overdose thanks to naloxone distribution, and we want to forward that message as well. So register, get your link, get your swag bag, watch your party, host and participate in the panel, and then send us a pic. And that's all there is to it.
Thank you, Jennifer. So we hope to see you virtually next week for what I'm sure will be a wonderful panel discussion about overdose awareness and recovery. Until then, stay well.